Good afternoon, everyone. And I'm pretty sure you can hear me, right? Because I'm loud. You heard my name is Dr. Moirar. I come from Nantucket on Island. If you're not familiar of the East Coast, there is an island, a beautiful island in Nantucket. And I came here today to share with you about wholeness. And it's such a privilege because often the medical system is so separated. And I just got so excited because I met Matsumi today that's working on her residency, correct? And she lifted me up and gave me a lot of hope that one day my hope will be concretized, that we will be working together in the medical field where everything is integrated. So thank you so much, Tolu, for inviting me. Thank you, Angie. Thank you to all of the organizers for being here and talking about such important topic and understand the importance of mental health for women. Today, I want to shift the way we talk about mental health, not as weakness, not as disease. I want to emphasize what it is to understand the mind-body connection and integrative care for women in general. We ask very often, what's wrong with women? And sometimes we ask ourselves, what's wrong with me? I think a great question we need to start asking is, what is it women have been putting up with and what they have had to survive? Because 15 years I've been working as a licensed mental health counselor. I've seen young girls struggling at all levels. I work with kids from 3 years old up to adult, 82 years old. And I can tell you, from the age of 5 and 10, I start seeing across the board the same challenges of women uncertainty. So as I was listening yesterday to Dr. Bouquet and talking about trauma, the generational trauma we carry, and integration is the key for us to move on to a better world. So I want you to close your eyes for a second. Imagine the suffocating darkness that wraps around your soul, dragging you down into a bottomless pit of despair. Absence of mental health. It is not just a word. It is a relentless battle that steals your joy, erodes your hope, and whisper in your ears the cruelest lies. Open your eyes. I want to have a conversation with you about wholeness. Not the type that separate us, not productivity. I want you to start thinking the body, the mind, the spirit, they function as one unit. And the moment we start shifting, the moment we start thinking we can separate them, we start having a serious problem. And my 15 years so far working as a mental health professional, I have found out that I can tell you in maybe 5 or 3 occasions, I was able to sit down with a doctor that have prescribed to one of my patients medication. We don't communicate. And it's hard for me because sometimes it is even impossible to let them buy in that your patient is my patient and we must collaborate. So when we talk about mental health for women, we no longer need to talk about perfection. We need to look at wholeness in its integrity, the kind that embrace the complexity of culture and also care. Because working as a Latino Caribbean, we cannot serve all our patients the same way. I had the pleasure to work with women from Europe, Black, Indian, Chinese. I can tell you, if you don't have the cultural competency to understand them, you're doing them a disservice. And trust can only establish when you understand them in their integrity. The trust that they put on you, because they come with so much fear and anxiety already. So when you come, you're sharing with them your victory. And listen to them like human beings. They buy in and they're able to make changes in their lives and they have hope. So in my clinic, the large amount of women I've been able to work with is not only mental health, because as an integrative doctor, I'm able to look at them not only because the mind is not functioning well, but because a lot of the time it's because physical issues they have causing the mental illness, anxiety, depression, eating disorder, a lot of the time trauma-based. And we carry all of that, and then we feel women need to be changed. Women need to be different. So it is time to get this event a boost, and all of us to show up with a different attitude so we can connect the dots. So my focus as an integrative mental health for women is completely found based on my own history. Over 18 years ago, I was diagnosed with a mental health disorder, and I suffered from depression, I suffered from anxiety, and I was also very sick. But I realized my mental illness was based on my physical illness. I was diagnosed with grave disease. 1 in every 6 women will be diagnosed at some point in their life. And most of the women that are not diagnosed, they have the disease until they find out through, because I had also grave disease, an autoimmune disease that almost killed me. I got to do some work. I spent 7 years going to my doctor. I was taking my prescription religiously. I took 8 medications 3 times a day. And living my little beautiful island was very challenging because I had to leave the island every 6 weeks. And my appointment with my medical doctor was no more than 7 minutes, no kidding. And I had to stay off island for that appointment. I couldn't miss it because I didn't want to miss my appointment with my doctor. And every time I go to the doctor, and my question was, Mrs. Leveille, how are you doing? I'm like, I don't know. I guess, okay. I'm taking the medication. And as I was taking the medication, I was getting worse. Things were not changing. And I decided I needed to do something about it. So I went home. I make a decision that my responsibility for my self-care, it was me. Start with me. I did quite a few self-development work, and I take care of myself, and I became a licensed mental health counselor, and then after I went for functional medicine, and then I went further, I went to become a doctor in integrative medicine. And then I found the piece of the puzzle that was missing. Mental health is not separated from physical health. And we need to educate our doctors. We need to educate our mental health professional. And I'm not saying it's only the doctors, it's across the board. We cannot treat women mental illness in silos. We must integrate health based on their culture and their heritage, because 1 in 8, every 5 women experience mental illness. And over 60% does not receive any kind of treatment. So when we focus on mental health for women, we focus as well on mental health for communities. We focus on mental health for campuses. We focus on mental health for the tomorrow, for the nation in general. So as I did my work, I was able to release over 60 pounds. I had gotten my health back, and my diagnosis was completely finished, done. And when after a year I've done my treatment, I went back to my doctor because we have a relationship. And I said, this is what's going on, this is what I've done. And then he did also a scan of my thyroid. He told me, Moira, you have the best thyroid I have ever seen. So whatever you are doing, continue doing it. And here I am with you sharing about wholeness. We can't take for granted taking care of ourselves. Our doctors, our mental health professionals are our ally. They are not there to fix us. They are not here to change us. Because the question, what's wrong with women, we need to stop doing that. So, we live in a fragmented system that we women have to collect the pieces and being able to bring to understanding how to better serve us. How we can teach the different people, doctors, we talking mental health professional, how to serve us better. And I can guarantee you, as the past 16 years working on this field, there is hope. The patient that I work with, they are my friend. I call them my children, my friend, my companions. We have fun. They come to my office not because they are broken, but because they want to have better understanding of their body, better understanding of how their lives can be better. The system, a lot of the time, what is being used is gender-based men to evaluate women. Can you believe most of studies that have been done to evaluate women have been based on men? And we are so different. We are complex human beings with hormones. And I look at this so beautifully because women start experiencing difficulties from puberty. And we don't have a break from there. puberty, go in there, you go to start dealing with the hormones, and then you move towards, oh, life is a little bit better, having children. Oh, now postpartum depression kicks in. Oh, no, now perimenopause. Oh, no, oh, I catch a break. No, now it's menopause. When do we get a break? We don't have a break. So we need to take care of ourselves. We need to do better. So mental health for women cannot be the same as it is for men. And it is so important for us to realize we are our own savior and our own rescue. No one is coming for us. It's time for you to go inside and start doing the work. It starts with you. It starts by digging and understanding you are not the same and you demand to be treated differently. And we need the system. We need better group peer support. We need different way to approach mental health. And it's so amazingly, I'm here in the School of Medicine to find out that every single day, due to mental illness, we lose one medical professional. Over 300 to 400 medical professionals die by suicide. So if it's not now, when? We need to start with women because women is the base, is the nurturer, is the base for consistently bring life. So if we start doing this, I want you to know. A lot of the time when people come to my office, it's so amazing to think about it when they hear those three words. There is hope. And then they can breathe. They can think, oh, I'm not alone. I am not alone in this journey. So, as we move forward, each one of you that here, can you take the responsibility to become an advocate, not only for you, for your children, for the next generation, to be treated as whole? Because we can no longer tolerate to be seen as broken. Because every day we are reborn. Every day we are shifting to new perspectives. So it is our responsibility to think differently and to ask for what we want. So to every woman who walk in every day carrying more just word, to every soul currently that is wondering, is healing possible? To every heart that has survived itself, let me tell you, you are seen, you are safe, and you are home. I used to wonder if there is room in this world for a woman like me, bruised by silence, been at the weight of what I couldn't say. Because I was always, during my previous career, made and believe that I was less than. I used to wonder if survival meant I was truly live or just learn to disappear every day. I wonder, am I strong? Because I remember at some point I was strong, but I remember, am I just playing, pretending? So I asked the sky, I asked the mirror, I asked the echo in empty rooms, is there is room for a woman like me in this world? But something sacred whispered within my soul, you are not what they said about you. You are what rose despite it. So for now, I want to encourage you, knowing healing is not about fixing broken people. It's about fixing broken system. Creating a space where women and individuals can be seen as whole. It's about taking in consideration the value, the culture, and the context in where we will be treating them. So I'm asking you today, instead, what is wrong with women? What is wrong with you? Ask this simple question when you go home. Look at yourself in the mirror. Say, what happened to her? I had to ask that. What happened to her? Or, better, what would healing look like if it was made just for her? Thank you.